Namaskar and welcome to the news at this hour. Let's begin with the headlines. 227 new cases of COVID-19 positive reported in the last 24 hours in the country. The total number of cases now rises to 1,251, 32 deaths due to the deadly virus, 101 persons cured and discharged. The Health Ministry says that DRDO is working with local manufacturers to increase the supply of N95 masks. Over 21,000 relief camps operational in various states, UTs, where more than 6.6 lakh people are sheltered. Union Health Minister Dr. Harshvardhan chairs a high-level meeting of the group of ministers on COVID-19, reviews the current status, actions and preparedness of states and union territories for management of COVID-19, emphasizes on social distancing and stay at home as a tool to combat the outbreak of coronavirus. The Delhi Chief Minister Arvind Kejriwal orders lodging of an FIR against person leading the congregation at the Nizamuddin Markaz, directs officials of tracing contacts of the people who participated in the assembly. ICMR approves first indigenously developed COVID-19 virus test kit. The test to cost 1,200 rupees as against the present cost of 4,500 rupees per test. DRDO says it has devised indigenous equipment including multiple use ventilators and isolation tubes to fight COVID-19 pandemic. And good news from the World Health Organization, as no new countries, territories or areas have reported cases of COVID-19 in the last 24 hours. The total number of confirmed COVID-19 cases nears 8 lakh mark, with over 38,000 deaths reported across the world. Our top story. In a Health Ministry press briefing, the Joint Secretary Love Agarwal has said that 227 new cases of coronavirus have come up in the country in the last 24 hours, and the total number has now risen to 1,251.
देश में 1,251 कंफर्म केसेस आए हैं और टोटल 32 डेथ्स रिपोर्ट हुई हैं। पिछले 24 घंटों में 227 नए कंफर्म केसेस और 3 नई डेथ्स रिपोर्ट हुई हैं। ये डेथ्स गुजरात, वेस्ट बंगाल और मध्य प्रदेश स्टेट से रिपोर्ट हुई हैं। केसेस में आए इस इंक्रीज का कारण है कि कुछ लोकेशंस पर लोगों के सपोर्ट ना मिलने से, समय पे सूचित ना करने के कारण अचानक केसेस की संख्या में ये इंक्रीज नोट किया गया है। और इसीलिए मैं अपनी कल की बात को दोबारा दोहराना चाहूँगा कि हमारी इस कोविड-19 की लड़ाई में हम उतने ही सक्सेसफुल हो पाएंगे जितना हमें कम्युनिटी में सबका सपोर्ट मिलेगा। इस जंग में किसी भी एक समाज के व्यक्ति का सपोर्ट ना मिलने पर पूरे समाज को उसका नुकसान उठाना पड़ेगा। और इसलिए मैं फिर आपके द्वारा सबसे अपील करता हूं कि ये हम सबकी सामूहिक लड़ाई है, हमें सबको मिलकर इसमें कार्य करना पड़ेगा।
And Love Agarwal has said that the Health Ministry is working in close coordination with the states in tracing the contacts of those who have coronavirus in the country.
हेल्थ मिनिस्ट्री राज्यों के साथ कोऑर्डिनेट करते हुए रिगरसली सभी कॉन्टैक्ट की ट्रेसिंग पर काम कर रही है, ताकि हम ये इंश्योर कर सकें कि एज पार्ट ऑफ हमारा जो इन्फेक्शियस डिजीज कंटेनमेंट स्ट्रैटेजी है, हम सभी मामलों को आइडेंटिफाई कर सकें और उन पर प्रोटोकॉल के हिसाब से एक्शन ले सकें। इसी संदर्भ में मैं ये भी आपकी दृष्टि में लाना चाहूँगा कि कुछ केसेस ऐसे आए थे जहाँ पर कि लैंड ओनर्स या होम ओनर्स जो डॉक्टर्स और पैरामेडिकल स्टाफ को उनको फोर्स कर रहे थे कि आप अपने उनको लोकेशंस को वेकेट कीजिए। तो जैसे कल मैंने आपसे कहा था, तो उन सब से हमने कहा था कि आप उनको वेकेट ना करें। और इसी के तहत दिल्ली गवर्नमेंट ने इससे संबंधित एक ऑर्डर भी एपिडेमिक डिजीज एक्ट में इशू किया है, जिसमें उन्होंने कहा कि सभी जिला मजिस्ट्रेट, म्यूनिसिपल कॉरपोरेशंस और डिप्टी कमिश्नर्स और पुलिस, ये सब एक्ट के तहत अगर इस टाइप की कोई उनकी नॉलेज में कोई ऐसी सिचुएशन आए तो उस पर वो एक्शन लें।
Love Agarwal has also said that the Ministry of External Affairs has identified suppliers from South Korea, Turkey and Vietnam to increase the availability of logistics items in the country. He said that the DRDO is also working with local manufacturers to increase the supply of N95 masks.
मिनिस्ट्री ऑफ टेक्सटाइल्स और फार्मा के साथ मिलकर और स्टेट्स के साथ कोऑर्डिनेट करते हुए हेल्थ मिनिस्ट्री पर्सनल प्रोटेक्शन इक्विपमेंट, मास्क, वेंटिलेटर्स और जो रिलेटेड लॉजिस्टिक्स हैं उनको प्रोड्यूस करने वाली फैक्ट्री के साथ उनको सपोर्ट करके कैसे इनकी अवेलेबिलिटी को बढ़ाया जाए उस पर काम कर रही है। मिनिस्ट्री ऑफ एक्सटर्नल अफेयर्स ने कोरिया, टर्की और वियतनाम के सप्लायर्स को भी आइडेंटिफाई किया है ताकि हम अपनी अवेलेबिलिटी देश में लॉजिस्टिक्स आइटम्स की बढ़ा सकें। DRDO लोकल मैन्युफैक्चरर्स के साथ मिलकर भी इसी तरीके से N95 मास्क और जो रिमेनिंग लॉजिस्टिक्स है उनको बढ़ाने के लिए कार्य कर रही है।
The Ministry of Home Affairs has said that the lockdown in the country is enforced properly and over 21,000 relief camps are operational in various states, union territories where more than 6.6 lakh people have been sheltered.
लॉकडाउन का एनफोर्समेंट स्टेट्स और यूटीज़ में संतोषजनक रूप से चल रहा है। एसेंशियल सप्लाईज़ की स्थिति भी संतोषजनक है। जो हमें राज्य सरकारों और यूटी से जानकारी प्राप्त हुई है उसके अनुसार लगभग स्टेट्स और यूटीज़ में लगभग 21,064 माइग्रेंट रिलीफ कैंप्स सेटअप किए गए हैं और इन रिलीफ कैंप्स में लगभग 6 लाख से अधिक, अगर मैं एग्जैक्ट फिगर कोट करूं तो 6,66,291 लोगों को शेल्टर की सुविधा दी गई है। इसके अलावा लगभग 23 लाख लोगों को भोजन की भी सुविधा प्रदान की गई है।
A high-level meeting of the group of ministers on COVID-19 was chaired by the Union Health Minister Dr. Harshvardhan in New Delhi. The Minister of Civil Aviation Hardeep Puri, Minister for External Affairs Dr. S. Jaishankar, Minister of State for Home Affairs Nityanand Rai, Minister of Shipping Mansukh Mandavia, besides others, were present at the meeting. Now, the group of ministers reviewed the current status, action and preparedness of states and union territories for the management of COVID-19. The government is laying emphasis on social distancing and stay at home as a tool to combat the outbreak of COVID-19.
मीटिंग हुई थी जिसमें हेल्थ मंत्री साहब के साथ मिनिस्टर ऑफ एक्सटर्नल अफेयर्स, सिविल एविएशन, शिपिंग, केमिकल एंड फर्टिलाइजर्स और मिनिस्टर ऑफ स्टेट फॉर होम और मिनिस्टर ऑफ स्टेट फॉर हेल्थ एंड फैमिली वेलफेयर सभी प्रेजेंट थे, जिन्होंने देश में चलती हुई सिचुएशन का पूरा एनालिसिस किया, जायजा लिया। उन्होंने इस सिचुएशन में ये भी कहा है कि हमें स्टेट्स के साथ मिलकर ये इंश्योर करना है कि जो हमारे डेडिकेटेड कोविड हॉस्पिटल्स हैं उनको जल्दी से जल्दी और लार्ज नंबर में बनाया जाए। स्टेट्स के साथ कोऑर्डिनेट करते हुए जो हमारे माइग्रेंट पॉपुलेशन है उनके बारे में भी अगर उनको हमने किसी टेम्परेरी शेल्टर में कहीं पर हमने उनको ऑर्गेनाइज किया है तो उनका मेडिकल चेकअप किया जाए, उनको रिक्वायर्ड साइको सोशल सपोर्ट प्रोवाइड कराया जाए और इसके साथ ही जो अगर नीड है तो नीड के हिसाब से हेल्थ प्रोफाइलिंग करते हुए उनको अगर किसी और फैसिलिटी मैनेजमेंट या होम क्वारंटाइन सजेस्ट किया जाए उसके लिए भी स्टेट के साथ हम चर्चा करके इसको ऑर्गेनाइज कराएं, उन्होंने आदेश दिए हैं।
The Director General of the Council of Scientific and Industrial Research, Dr. Shekhar C. Mande, has said that work is being done on monitoring of the virus, finding new ways of diagnosis, drugs, vaccines, as well as hospital equipments and the supply chain models. He added that many big industries are working along with CSIR to mitigate the coronavirus.
हम लोगों ने 5 स्तंभ चुने हुए हैं जिसके ऊपर CSIR में काम हो रहा है। पहला स्तंभ ये है कि मॉनिटरिंग और एपिडेमियोलॉजी देखना मॉलिक्यूलर इसके वजह से। दूसरा स्तंभ ये है हमारा कि डायग्नोसिस के नए तरीके खोज करें। आपने सुना होगा हमारे लैब दिल्ली में जो है IGIB, उन्होंने एक नया पेपर बेस्ड डायग्नोसिस तैयार किया है कि पेपर को अगर एक सॉल्यूशन में डुबाओ तो पता चलता है कि आपको कोरोना हुआ है या नहीं हुआ है। यह बहुत एक्साइटिंग खबर है हमारे लिए और इसके लिए हम लोग फाइनल स्टेजेस में कि इसका टेस्ट वगैरह करके तो इसको हम फील्ड में ले आ पाएंगे वो वाला। तीसरा स्तंभ हमारा जो है वो ड्रग्स वैक्सीन्स वगैरह पर है। चौथा स्तंभ हमारा जो है वो हॉस्पिटल इक्विपमेंट्स पे है। और पांचवा स्तंभ है कि सप्लाई चेन मॉडल्स बना। हम लोगों ने 20-25 जो मेजर इंडस्ट्रीज़ है हमारे देश में, सब बड़ी बड़ी इंडस्ट्रीज़ हमारे साथ एकजुट कर काम कर रही है और उनके साथ हम देख रहे हैं कि पांचों स्तंभ पे किस तरह से काम करें ताकि कोरोना मिटिगेशन में उसका हमें लाभ हो।
Delhi Chief Minister Arvind Kejriwal has ordered the lodging of an FIR against the person leading the congregation at the Tablighi Jamaat Markaz at Nizamuddin in Delhi. He also directed officials to trace contacts. Over 1,400 people from different parts of the country and Asia had attended a convention of Islamic preachers held by the Tablighi Jamaat earlier this month, out of which about 860 people have been admitted to different hospitals, while 300 more are being shifted to hospital. 6 people who participated in the congregation died in Telangana. A report of 10 people being infected by coronavirus in Andamans has also surfaced. 9 of these people had joined the congregation of the Markaz Nizamuddin. While more than 2,000 delegates, including those from Malaysia, Indonesia, Saudi Arabia, Kyrgyzstan, participated in the Tablighi Jamaat, and that happened from the 1st to the 15th of March at Hazrat Nizamuddin in New Delhi. Meanwhile, Meerut and Muzaffarnagar districts are on alert after Nizamuddin case surfaced. A control room has been set up in Meerut and the situation is being monitored 24/7.
फिलहाल मैं ये नहीं कहूँगा कि दिल्ली के अंदर कोरोना लोकल ट्रांसमिशन भी अभी फ़िलहाल कंट्रोल में है, कम्युनिटी ट्रांसमिशन अभी नहीं हुई है। केसेस बढ़े हैं और मरकज़ का जो पूरा सिलसिला हुआ अभी उसकी वजह से मरकज़ से जिन लोगों को निकाला गया है हो सकता है उसमें बहुत सारे केसेस पॉजिटिव अगले 2-3 दिन में आएँ। वहाँ पे जितने भी लोग निकाले गए हैं उसमें जैसा मैंने बताया अभी जो टेस्ट्स के कुछ रिज़ल्ट्स आए हैं, काफ़ी रिज़ल्ट्स आने बाकी हैं। 24 लोग पॉजिटिव केसेस मिले हैं, उनमें 441 लोग ऐसे हैं। अभी तक 1548 लोगों को मरकज़ से निकाला जा चुका है। उन 1548 में से 441 सिम्टोमेटिक थे।
Well, Delhi government has announced that it will increase the number of food distribution centers from the present 500 to 2,500 so that social distancing is adhered to effectively. In a tweet, the Lieutenant Governor Anil Baijal said, "It has been decided to increase the number of food distribution centers from the present 500 to 2,500 so that social distancing is adhered to effectively. Home quarantine has been strictly monitored. More than 20,000 homes have been identified by GNCTD for home quarantine." The decision was taken after the daily video conference meeting between the LG and the Chief Minister, Arvind Kejriwal. Chief Secretary, Commissioner of Police and other officers also were present. LG said that ensuring social distancing is the topmost priority at the moment. There have been reports about violations of social distancing norms at some food distribution centers, which led to this decision. The Supreme Court has made pertinent observations on the issue of exodus of migrant workforce. Taking a note of the current situation, it has asked the centre to set up committees, a committee of experts in fact, and a portal within 24 hours. Earlier on Monday, the Supreme Court had dubbed fear and panic over the COVID-19 virus outbreak as a bigger threat than the pandemic itself and asked the government for a report on the steps it has taken to deal with the problems posed by the sudden exodus of migrants from cities to the hinterland. Here's more.
The Supreme Court has asked the centre to set up a portal within 24 hours for dissemination of real-time information on the coronavirus pandemic to counter the panic being spread through fake news. Solicitor General Tushar Mehta told the court that the government has been taking preemptive, proactive and preventive steps. Information about the new virus came out on 5th January 2020. Preparations began from January 17 even before the first case was reported in India. The government took steps much before many other countries. Screening of persons returning from other countries was started much before any case was detected in India. Most of the countries started thermal screening much later. There is less spread in our country than other countries. 15.5 lakh persons have been screened at airports and 12 lakh at seaports. 3,48,000 persons have been monitored so far.
Solicitor General told the court that fake news is one of the most unmanageable problem, and to counter this, the government is setting up a separate unit headed by a joint level secretary officer from the Ministry of Health and including health experts and doctors from the AIIMS and other hospitals. This panel will answer query from citizens so that they don't rely on incorrect information. Meanwhile, Solicitor General reiterated that migrant movement cannot and will not be allowed. He said, as of now, rural India is unaffected from coronavirus, but there is a possibility of 3 out of 10 people moving from cities to villages carrying COVID-19 virus.
The top court observed that panic will destroy more lives than the virus. It asked the centre to get trained counsellors and community leaders of all faiths to calm down the migrants who are kept in shelter homes across the country. It also asked the centre to ensure that migration is stopped and to take care of food, shelter, nourishment and medical needs of the people, and also to follow up cases of COVID-19. Responding to this, the government said it will shortly implement a system to quell the panic of migrant workers, including counselling. The bench asked the centre to ensure the duties of managing the shelter homes where migrants are being kept are entrusted to volunteers and not to the police, and there should not be any use of force or intimidation. Vikas Sarthi, DD News.
The central and state government in Delhi, they have come up with a novel idea. This is to convert several government schools into shelter homes to accommodate migrant workers, as well as to stop their exodus to their other homelands in the face of the nationwide lockdown, which has been put in place to stem the spread of coronavirus. Now, thousands of migrant workers, if we recall, and daily wage workers have been stranded in Ghazipur, and that lies on the border of Delhi and Uttar Pradesh. Now, as the coronavirus lockdown has left many without jobs or money to buy food or to pay rent, thousands of these migrant workers have been walking back to their homes in a bid, to tide over the harsh times. So this is what our correspondent Tapas Bhattacharya has done. He's spoken to the estate manager of Shiv Shankar Tiwari of the Sarvodaya Kanya Vidyalaya in Delhi's Ghazipur, and they took stock of the situation.
Lockdown is in full force in Delhi, and we are right now in East Delhi, where one of the schools, one of the government school, has been turned into a Ran Besara, where people have been provided not just shelter but also food for the 3 times as well as for whenever they require. This is a school which is providing relief material as well as food. So please provide us the details of how many people are right now staying here. How much food are you providing them?
We are providing them night shelters and foods. Everything in breakfast, lunch and dinner, and sanitation items and toilet facility is available here.
So toilet facilities, sanitation as well as the food. Now, how many people right now are staying here?
Approximately 250 persons is stay here and give us target approx.
So
we are ready for handling.
So as of now, you could say that this school has a potential to have 2,000 or more than 2,000 people who can be accommodated here. Right now, 250 people are currently staying here, and they have been provided with food and other amenities. And this is one of the most important aspect of this lockdown. These people, the school is one of the many schools which have come out with the intention of helping those in need. And this is just the beginning, and this is an important aspect of this fight against this coronavirus. This is Tapas Bhattacharya, Doordarshan News, Delhi.
The Assam government is enforcing a total lockdown in the state with cooperation of the people. Assam is amongst those few states where no case has been found of coronavirus as yet. In an exclusive interview with DD News, Assam's Chief Secretary Kumar Sanjay Krishna elaborated on the state's preparedness levels to prevent the outbreak and to deal with it if it happens.
How prepared is the state of Assam to deal with corona?
We are quite prepared in a way. We have kept quarantine facilities ready for about 4,000 people, and near 1,000 isolation facilities are available, and numbers of ICUs are not very high, but still it's about 50, and we have already identified the medical colleges exclusively for COVID patients. So we're taking all necessary steps, and we have been very lucky to say that more than 300 tests have been done, and all of them are negative still now.
So, the state of Assam hasn't reported a single case till now. So under the present circumstances, what's the strategy of the government? Is it aggressive testing, putting people into quarantine, making social distance? What's the strategy which is being adopted?
Number one is social distancing. On 14th of this month, we have closed down all the schools and colleges, all universities. Then on 23rd of March, we have closed down the state for 1 week. And 24th, there's a nationwide closed down for 3 weeks. We instructed all the enforcing agencies to enforce it fully. That is one. Secondly, in the third week of this month, we had a lot of boys and girls and men coming from various states. Proper checking was done in all the railway stations, all the airports, and we have asked these people to go for home quarantine, 14 days of home quarantine. And a lot of people have crossed the border after the lockdown, and we have all kept them in quarantine facilities in those districts. We are not allowing them to go to their homes. We are following the quarantine thing is very, very seriously. We have utilized the ASA workers, Anganwadi workers, and all field level people to check these people whether they are following this quarantine or not.
So let's get you some international news now. An official from the World Health Organization has said that the outbreak of novel coronavirus around the world will not stop anytime soon, and countries need to step up to slow down the virus's transmission. Takeshi Kesai, WHO's regional director for West Pacific region, said that there are still no specific treatments or vaccines available against the fast-spreading deadly COVID disease. While several companies have started undergoing clinical trials of the vaccines, none are yet available for public consumption. Speaking on the lockdowns and declarations of emergencies around the world, he said that with all these measures, the risks will not go away as long as the pandemic continues. Now, rather than these measures, people can also buy valuable time because of these measures to prepare for large-scale community transmissions. So this is what has been said. Moving on then, Japanese Foreign Minister Toshimitsu Motegi urged citizens not to travel to 73 countries and regions, or a third of the countries of the world, that is, as the government fights to prevent an explosive surge in coronavirus cases. The ministry issued a level 3 travel warning against the United States, Canada, China, South Korea, Britain, among others, adding that more than 20 countries, mostly in Europe, and they warned against travel there in recent weeks. The government is set to ban entry of non-Japanese nationals from the newly added countries, as it has for the previous ones as well. Mexico has declared a state of health emergency and issued tougher rules aiming at containing the fast-spreading coronavirus after its number of cases jumped day by day, along with a rise in the death toll. The health officials reiterated the warnings that the health system could be overwhelmed if the coronavirus is not contained. The new measures to fight the virus include a reduction of the number of people who can gather to 50, as well as an extension of previously announced suspension of non-essential activities. Mexico has one of the world's highest rates of both obesity as well as diabetes, and experts have recently sounded the alarm that its population could therefore be more vulnerable than its relatively young average age might suggest. Now, the Foreign Minister, Ed Bard, has said that, who announced the health emergency, said that people or companies who ignored the rules would face administrative or penal actions. The emergency would be enforced till April 30. Hundreds of tourists, mostly British, breathed a sigh of relief as they departed an Air Force base in Peru to a flight which is going to London, after many had feared being stranded in the Indian country. This is after the border closures and cancelled flights due to the coronavirus outbreak. As many as 700 tourists boarded buses that took them from hotels in Lima to the Air Force base in the city of Callao, where they boarded flights. This is the second round of repatriation flights that the British government has organized from Peru in the wake of the COVID-19 pandemic gripping the world. The Peruvian government cancelled the commercial flights arriving to and departing from Peru on March 13 in Peru, and that has imposed tough rules, including isolation measures and curfews to stem the spread of the coronavirus. And with that, we conclude this bulletin. Thank you very much for being with us. Namaskar.